Good afternoon and welcome to your Construction Safety Association Manitoba's 2024 Safety and Health Week virtual webinar series. Safety and Health Week is a continent-wide event spanning the countries of Canada, US, and Mexico. The goal of Safety and Health Week is to focus the attention of employers, employees, partners, and the public on the importance of preventing injury and illness in the workplace, at home, and in the community. My name is Megan Story, and I am the Training and Development Manager here at the Construction Safety Association of Manitoba. We are proud to be recognized as your premier and trusted source for safety and health information, resources, training, and core certification. Today's Safety and Health Week virtual webinar is an example of how we are striving to provide you with practical and relevant information to help with accident prevention in your workplace. For those of you who know CSAM, quite simply our answer is yes. How can we help? We will have the answers to your safety questions, or we will find the answer with the help of our qualified resources and partners in safety and health. Today, I'm pleased to introduce Marty Danielson, who will review workplace safety and health stats for the construction industry here in Manitoba, including improvement orders, stop work orders, serious incidents, administrative penalties, and prosecutions. Please note that this webinar is being recorded and a copy of Marty's presentation will be made available. Should you have any questions, please do put them into the chat. Marty will be taking those questions throughout the presentation and answer them as they come up. So please put those questions into the chat. Otherwise, at this point, I'd like to pass off the presentation to Marty. The screen is all yours, Marty.
Thank you. Good afternoon, everybody. Can you folks hear me okay? No issues? Okay. I'm just going to share my screen here quickly. It's freshly trained on this by Megan, so see what kind of student I am. There we go. Okay, we can see that?
Looks great. Thanks, Marty.
Okay, good. So as Megan said, so thanks very much for having me to this important event, this important time we're going through right now with Safety and Health Week. It's a wonderful thing. Good for you folks for attending and taking it seriously. I've been at workplace safety and health now for almost 15 years. I started off in the field. Then I went through management of field staff, and now I'm in client service and technical support. And I do quite a few of these presentations and events to help spread the word and let people know the work we're doing, what we're seeing when we're out there. So as Megan mentioned, if you have any questions, feel free to jump in. I can't see you both, kind of. I can only see Megan, so if someone has a hand up or something, I wouldn't know. I think 95% of these presentations I do, I'm looking out at 40, 50, 100 people right now. A little bit odd to be doing it in a new way of life, but here we go. So we'll jump into it. So today we're going to talk about our enforcement strategy, our inspection stats as a whole in all sectors, and then also in construction. We're going to talk about serious incidents as a whole, and then also in construction, fines and prosecutions, reprisals and collections. So it's a little bit, we have 1 hour. It's a bit of a different presentation to gauge how long it'll take. These can go 1 hour and 45 minutes, hour and a half easily, but if there's good discussion, if there's limited questions and discussion, it could easily be wrapped up in half hour, 40 minutes. So I'm hoping we have some questions. I'm also hoping we get through the information that we want to get through today. We'll jump into it here. So why do we all do what we do? At every presentation, if you've ever heard me speak or seen me speak, this is something I'll touch on every single time. Can I get this out of the way here? So in last year in Manitoba, 21 workers were killed because of their job. The year before it was, or 22 were killed because of their job. The year before it was 21. In Canada, annually, about 1,000 workers die each year because of the work they do. Just recently, there was 2 workers killed on the same day in Manitoba. That was actually in construction also. 2 separate workplaces. It's unimaginably devastating for the family and the co-workers of these people. No one expected that day to go that way typically. You walk out the door expecting to come home to your family. You walk out the door with a plan for tonight, for tomorrow, for next year. And you don't know it, but there's a clock above your head and it's ticking backwards and it's down to maybe minutes or hours. And you have no idea. Often when you look back at these incidents that have happened, it's often a change in events that happened that day. You know, a different person is doing the job that they typically do. We're working with different materials than we typically do. It's a different machine, something that seems, when you trace it back from the fatality backwards during investigation, you'll get to a point where it looks like there was an innocent fork on the road. And that's the chain of events that starts off and ends so tragically. So keep that in mind, folks, when you're using different people for the work, or different materials, or different tools, or different job sites. That it can often, most of these 22 people here have had something like that happen in their day, and no one expected anything like that. So if you take anything away from this session, just remember that it's often the very smallest thing that turns into something huge. Okay. Now it's not really negative. There we go. Okay. So at Workplace Safety and Health, we have an enforcement strategy, right? So we have this pool of resources, and we want to make the biggest impact that we can make in workplaces in that building, keep everybody's lives intact and their bodies intact. And so we look at how do we do this? So we have a strategy we try and focus on each year, and we will alter it from year to year as we see injury trends jump up in a different area. But essentially, our enforcement strategy focuses on industries through Manitoba that have higher risks at their workplaces and are not effectively managed. We look at the places that demonstrate willful, repeat non-compliance for high hazard contraventions, high risk workplace with an emphasis on those with increasing high injury rates or illness rates. So what does that mean? That means that if you're in a sector where everyone's got a fairly low injury illness rate and your company's higher, we'll go take a look and see what's going on there. Why is there so many injuries being produced at this one company when everyone else does similar work? And we'll also do the opposite. We'll go to if there's a bunch of employers in a certain sector that, sorry, I'm going to silence my phone here. If there's a bunch of employers in a certain sector that are along a certain line of injury and illness, and there's one that's real low, we'll also go there and just one of two things is happening. Either there might be claim suppression that's going on there, and we need to go take a look at that workplace and see what's going on. Or maybe they have a really good handle on things, and there's a best practice that no one else even knows about. And there's things that we can see and we can learn and maybe share with other employers with their permission. We wouldn't be letting any secrets out, right? We'll also go to workplaces that just random routine inspections, just to keep them honest type inspections. It's no one is immune from having a workplace safety and health inspection. We look at workplaces that fail to notify workplace safety and health of serious incidents. So again, we work with the WCB. Each month they send us a list of all the serious incidents that have been reported to them, and we'll review them on our case management system and see if they reported to us too. If they weren't, they're going to get some kind of attention from us. It might be a phone call, it might be an actual inspection. It's going to depend. And same thing, we send our serious incident list to the WCB, and they're going to make sure that the people that reported injuries to us reported to them. So we work together to make sure that all the information that should be provided to employers from employers is provided. We spend more time in the workplace that do not have appropriate systems or strong safety and health culture in place, as both are essential in keeping workers safe on the job. And then during inspections, you'll often see us with an employer or employer representative and a worker or worker representative touring the workplace. We're going to be asking about certain areas of the workplace, maybe different activities that are going on. We may get them to demonstrate machines that aren't being used. You know, can you get someone to operate this one and show us how this is used? So that's not uncommon for us to be doing that type of stuff during our inspections. That's my meeting. All right. So now we're into the stats. So we run on a fiscal year, not a calendar year. So for last year, from April 1st to March 31st, workplace safety and health, we did just over 6,000 inspections in all industries. So of those 6,000 inspections, 62% resulted in orders. So I think there might be a thought out there that if we show up, orders are happening. That's not the case. 38% of the time, orders weren't issued when we did our inspections last year. And 13,000 improvement orders were issued in total. But in construction, so of the 6,000 inspections we did last year, 1,661 were in construction, which is about 28% of all of our inspection activity. 922 inspections resulted in improvement orders, so 55%. So if you look as a whole in Manitoba, 62% of our inspections resulted in orders, but in construction, it's actually lower. I think that's a good sign. 55%. So 45% of the time, there was no orders issued. There was 377 stop work orders in all industries. Now, if you look, lots of these were in construction. 211 of those were in the construction sector, which is quite a bit. So if you look back at the top here, we issued 13,000 orders in total. So most of those are improvement orders and 377 stop work orders. So we don't issue those very often. That is, like there's something imminent going on there. We feel that if we don't issue the stop work order, someone's at risk of getting something removed from their body or losing their life. Or they're going to fall and be paralyzed or significantly injured. Something bad's going to happen. So we don't issue those that often. I think there's a thought that we issue lots of stop work orders. We do issue on average over one a day, but if you look at the ratio between total orders issued and stop work orders, it's actually very low. We don't issue that many of them. And because officers, they take that into account when they're looking at the situation. They're looking at the hazard, the risk, and the severity. Okay, so officers have a legal obligation to use their discretion. If you look in the Workplace Safety and Health Act, as I look at my copy over here, it says that an officer may issue an order, which means they legally have to use their discretion. We couldn't tell our officers that if you see someone working at heights without fall protection, it's a mandatory stop work order. That would be against administrative laws, and that would be called fettering discretion. We can't tell them how to use their discretion. They have to use the training that we give them and apply it to each situation they're looking at. So you might have, the example I often use is there might be a little rural road north of Winnipeg a couple hours. And one of our officers could be driving down that road and see a small construction crew doing some road construction or something. And the workers are wearing their appropriate high vis, or sorry, they're wearing high vis, but it's not appropriate. It's not the right stuff, but they have it. Our officer is going to look at, so the contravention is they're not wearing the proper high vis. The hazard is them getting hit by a car, but the risk is really, really low because there's no cars around. We were the only car in sight. So in that case there, the officer might just slow down and drive by them, or he or she might, have a chat with them. But they might not even get an order at all. Now you take that exact same crew and you put them at Portage-Germain at 9 o'clock on a weekday in the morning. The hazard is identical. It's them getting hit by a car, but the risk went through the roof. So that exact same crew and that exact same officer doing the exact same contravention in a different risk environment may now get a stop work order. So that's how our officers are trained on how they're going to use the tools that they're given. So lots of times we'll have people calling us saying, we have one officer come and no orders were issued. We have another officer come and several orders were issued. It may vary. We want to make sure that our officers are trained consistently. We want to make sure that that an interaction with us is going to be similar in nature each time. We have a rigorous training that our officers go through. There's pretty much a 3-month classroom session that officers go through prior to going out in the field. And even when they go out in the field for the first while, there's a huge mentorship that goes on with them before they're actually out issuing orders and doing inspections alone. We want to make sure that it's if it was manufacturing or building a product, we want to make sure each product looks the same when it comes out the door. We're trying to do the exact same thing with the officers. Any questions with any of this so far? By group. Okay. So this is where you might want to write this down. taking on the way here. So top order types for construction. So if we're gonna do an inspection at a construction project, here are the orders that we are likely to issue. Here's the top 5. Now we issue, I could pull the construction list and it's probably 20 or 30. But here's the top 6 most common orders that we issue. Number 1, probably no surprise, is fall protection. Number 2, that's in general duties. The general duties is larger. I think general duties, if I look like at section 2 of the workplace safety and health regulation, I think general duties is probably, there's going to be lots of orders that go into that one. But I would say the bulk of them are probably around serious incidents, failure to report, failure to secure your scene, failure to do an investigation. So when we get the list from the Workers' Compensation Board and they say that ABC Construction had a worker that suffered a laceration, and we see it wasn't reported to us, we will then reach out to ABC Construction and say, hey, listen, we were made aware last month that workers such and such suffered a laceration, and it wasn't reported to us. And you need to ensure that, we'll school them on the reg, that you need to ensure that the scene is secured and it's reported as soon as possible by the fastest communication available. So, and that employer, now depending on the circumstances, that employer could get failure to report, failure to secure the scene, and failure to conduct an investigation. Because likely we find that when they didn't do one, they didn't do anything. So that can really jack up the improvement orders in that area for construction. So make sure you're reporting. We'll get into serious incidents in a bit, but if the incident happens, it doesn't automatically mean that workplace safety and health is coming up. We get about 1,200 serious incidents a year reported to us. And I would say guessing, based on data from previous years, I would say probably about 200 of them we respond to immediately. So 1,000 of them we're not coming out to. One of 3 things is going to happen if a serious incident happens. The other employer or fire paramedics will call us and say, we're at this location and a worker has suffered X type of injury, or it looks like they've suffered these types of injuries. We'll say to the employer, either hold the scene or sending an officer out, or else you're okay to do a self-investigation and release the scene when you're done. But someone's going to be in touch with you the next day or 2 to get the investigation, to find out what happened, to see what controls you're putting in place, or else we're going to release the scene to yourself. You can self-investigate, conduct your own investigation. Again, hang on to your investigation, because in the future, when an officer comes out, they may ask to see that. So one of 3 things happen. So of the 1,200, probably 200 of them, it is hold the scene, we're sending someone out. Those are usually pretty bad ones. But it doesn't mean necessarily someone's coming out right away. So just so you guys know. The third most frequent one we have is PPE. That's going to be fall protection, respirators. That's going to be high vis. It's going to be hard hats. It's going to be steel toes. It's a variety of things that can happen with PPE, as you can imagine. We're seeing a lot of orders being issued in excavations lately. We're seeing employers stepping or being out. First, the reg doesn't allow for stepping out. Okay, just so you folks know that the reg doesn't allow for it all, but you're allowed to be out at 45 degrees. But we're having employers, they say, or they're attempting to be out at 45, but it's nowhere near 45. And it's at the risk of sloughing off and injuring or killing workers. So we're seeing no shoring. We're seeing excavations that haven't been, we haven't been notified prior to the date. We've lost stuff around excavations. Spoil piles are too close to the edge. The machine is too close to the edge. And excavations can turn into, just recently we had an excavation slough off where a worker was killed. So they can go bad really, really fast, and it's nothing to mess with. So take a look at that, folks. It's our number 4 order in construction. Machines, tools, and robots is our number 5. Does anyone know what a machine, tools, and robot order would be for us? Making eye contact with your hand.
Like backup lights, alarms, making sure that there's inspections being completed.
That's a good guess. So that would be under PME, power mobile equipment, which actually doesn't even crack the top 6. I would say though, that it's probably in, it might even be top 7. PME, power mobile equipment, we do issue lots of orders in, seatbelts, inspections, rollover protection, ROPS. In mining, it's called FOPS, which is fall on protection because stuff falls on machines. So machine tools and robots is usually around your tools, your power tools like table saws, equipment like that isn't appropriately guarded. It might be a big compressor with a big pulley on the side, a big gas or electric compressor with pulleys on the side, and the pulley isn't guarded. It's typically going to be in guarding, or else the equipment is in disrepair. It's not the way the manufacturer intended it to be, and things are broken. It could be on a circular saw where the guard isn't popping down appropriately. So there's different things around machines, tools, and robots that we are seeing, but it's our number 5. We see lots of amputations, folks, tons of them. There might not be as much as there once was, but I would guess there's 1 a week for sure. Sometimes with multiple fingers. We've had arms and whatnot too. They can be really, really bad, a bad injury. And then our number 6 is asbestos. And asbestos is the leading workplace fatality, the leading cause of workplace fatalities in North America. The thing about asbestos is it has a latency period. All the other ones, the top 5, they're going to be an acute hazard. It's something that's going to get you that day. Those, within seconds of it going sideways, or that same second. Asbestos can come back and get you in 5 or in 10, 15, 20 years. But it's a leading cause of workplace fatalities. It's people that have developed mesothelioma or asbestosis, where these minuscule fibers, they're breathing them in and they're getting into their cavity and they're causing cancer, and it's taking their lives. That one there, it can come back to people at home too. If it's coming home on your clothes, your kids are supposed to be breathing it in. And it can be causing troubles for your whole family. And also keep asbestos in mind as far as doing any of your own home renovations. Now, if you're a homeowner and you're doing your own bathroom, the Act and reg won't apply to you, but asbestos still will. It doesn't care if you're working or not, it'll tell you. So take that into account with your family, with yourself, with your friends. If you think you're disturbing it, you'll want to make sure it's taken care of properly, because it's gonna affect you, or take your life or your loved one's life in 15, 20 years, like it does all the time in Manitoba. It's quite dangerous. Any questions about that stuff? No, I would say that fall protection and asbestos probably make up the bulk of those improvement orders that we're seeing. Or sorry, those shop work orders that we're seeing. Because you can see how they're both so limited, right? They don't, it doesn't go well. We had a worker this year fall 18 stories from a building, and obviously you don't survive that type of fall. It's devastating. It wasn't supposed to happen that way for that person that day. They were supposed to go home to their family and they didn't. So, if you haven't taken notes, maybe take a picture of the screen or something like that, and go back to your workplace and focus on these things and see if these things are in place at your workplace, or if people are at risk of getting severely hurt and killed. That one thing that keeps you, I often tell people that one thing that keeps you up at night, go deal with it first. Because it's probably going to happen. If it's keeping you awake and you're aware of it, it's probably going to happen. It's just, someone can do something dangerous. Like there's this, I fly, I haven't in a while, but I fly airplanes. I'm a pilot. I fly float planes and whatnot, and twin engines and whatnot. But there's a saying in aviation that there's old pilots and there's bold pilots, but there's no old bold pilots, because eventually it catches up. And it's similar to working on this type of stuff. We'll often do an inspection where someone tells us that we don't know what we're talking about. They've been doing it this way for years, and they know, they know better. But we also see, the other side of that, we see the fatalities and serious injuries that did catch up with a person that's been doing it that way for years. So. Wrong way again. Okay, so this is kind of leading into the serious incidents here. So if you look at the screen here, it's obviously serious incidents by industry. But if you look down here, this is immediate response. So these are the ones that make up. So these are the ones we're going to immediately. Basically, the worst that happened, this is the worst of the worst. Okay, if you look at the 1200, what industries are the worst ones happening in? And you can see who the two are. Manufacturing and construction. This is why if you look at where we're spending the majority of our time, and we'll go in all sectors for sure. The majority of our time, you're going to see it is in construction, manufacturing, retail, and service. Retail and service is a little bit odd because retail and service are lumped together. But it's really service that's producing the most of these injuries. The service is like automotive, mechanics, auto body shop, like more of the industrial type stuff. The retail side is, you're selling, cars or clothing or whatnot, and it's a lower risk. And people can get hurt, but the chance of getting hurt, like these people in construction manufacturing, is really low compared to them. So this is where we spend a big portion of our inspection efforts are focused in these areas, because if you remember back in the beginning of the presentation, I said that we have an enforcement strategy and we focus on the workplaces that are likely to injure workers. We're focused on the workplaces that there's willful non-compliance. If we've been there before, we've written those orders before, we know they know better, but every time we go there, we're finding issues. Like those employers have special attention from the branch, and we target them. We continue to go back. It's not by accident, it's on purpose, because we want to make sure that workers in that workplace are not going to be subjected to hazards and risks associated with that type of behavior. So we go there on purpose. If you look through here, and public admin and defense, this should just say public admin. A lot of our stats we get from the Workers' Compensation Board. So defense would fall under the federal government. So this year would be actually public admin. And public admin is, City of Winnipeg, government of Manitoba, those types of areas. Also has our attention. Education. Yeah. Any questions with this? You guys are a light crowd. I think we're quite a bit ahead. We're halfway through, or we're halfway through the presentation, but I think we're more than halfway through. We're halfway through the time, but more than halfway through the presentation. Okay, we'll find the prosecutions. People usually like discussing this one. So since 2018, there have been approximately 60 convictions in Manitoba, with other files currently before the courts. So we do an inspection or an investigation. We order the employer to provide us a copy of their investigation. We'll take our photos, we'll do our interviews, and we find out what happened at that incident. We work with justice, and then sometimes charges are laid, and often you get convictions from those. Like I said here, since 2018, there's been 60 convictions in Manitoba. In Manitoba, the first offense isn't to exceed $500,000 or $50,000 for each day of the continuing offense, or a second offense isn't to exceed $1 million or $100,000 for each day that the offense continues. And on average, workplace safety and health issues, nearly 20 administrative penalties each year. So if you think about that one, if we go back to the beginning, where we do 6,000-ish inspections last year, just over 6,000, 13,000 orders, almost 400 stop work orders, and 20 administrative penalties, that isn't a lot. So when we're issuing administrative penalty, we 100% know that the tools we've been using aren't working. The improvement orders aren't working, the stop work orders aren't working. The employer seems to 100% get it, but yet they're doing the exact same behaviors. And that's when the administrative penalties are being used. So if you are an employer, or of an employer that did get one, it's very small company. let's say there's 70,000 employers in Manitoba-ish, a million plus people, 600,000 workers, that's just spitballing. Think of 20 administrative penalties, how small that is, right? It's just a dot on a map. So if you know of one, it's a special category you're in, and it's not one you want to be in. Those are often names that we all know about here. We definitely don't know of all the employers in conversation in Manitoba, but we know those 20 because we know their names. They're often spoken about. We catch the same behaviors over and over again. And if you think of it, if we were to go to a construction site, let's just use fault protection as an example. If we go to a construction site, we go to ABC Construction, and we issue stop work order, and the employer sends us a report of compliance saying that they're going to ensure that their supervision and PPE and training and anchors on site, and the fault protection systems will be working going forward. We know they know better, and we go back again and we catch that employer again with their workers working in an unsafe manner, and maybe on the second or third time they're getting an administrative penalty, and then eventually they have a worker that falls and gets hurt or killed. Think of the case that we would have against that employer, ABC Construction. We would literally give the Crown our file and say they've been caught 3 times in the last year or the last 2 years working at heights. Each time they said that they're going to make sure their workers are trained and their supervisors are supervising, and they're going to have protections in place, and all this stuff's going to be in place. They're not going to do it anymore, and yada yada yada. And now we have a worker that it is, first of all, it's devastating for that worker's family. But the employer may not even survive that. They, I've been told before that the cost of a fatality can easily hit $1 million once everything's said and done with insurances and whatnot. And most small business won't survive it. But like that's the financial side of it. The human side is someone's dead because of the work that your business was doing, and you do better and you didn't put the protection in place. So it's 100% preventable, but here they are. So when you get those, think about, if you get a stop work order, think that there's only 300 a year, 277 in construction a year handed out, about 1 each working day type thing. So it's not many. Of the 13,000 or 12,000 orders issued, it's pretty unique category you're in, and should be changing the way you're doing business because it's going to catch up with you. Questions?
Marty, there is one question here.
Yeah.
Carol asks, if you get an improvement order, do you go back and check on that site again to see if they are complying?
Yeah, so that's a great question. And that is called, so an administrative penalty has its own regulation. And it tells us where we can issue administrative penalties and where we can't. And it's got things called prescribed provisions. So there's some things that you only have to do once, and you can actually get an administrative penalty for. Things like asbestos or fault protection, things like excavations. Those are so dangerous that if you're caught doing them once, you could get an administrative penalty for that one time. Other things like machine guarding, if we catch you working without a guard on your machine, for example, you can get an administrative penalty that time. But what we will do is there's going to be detailed notes. It's going to have the model number, a serial number, the location, the supervisor on site, maybe the worker working with it, all the information we can get. And anytime that a similar order is issued to that employer, if the same order is issued to that employer, we're going to look back and see, like we will go back and check on these machines. But we'll also make sure that has that order been issued before? If that order has been issued to that machine before or to a similar machine, let's say you have 2 or 3 identical or similar table saws on site, and we got you for machine guarding on that one, and the next time we go there in 2 weeks, there's another one of 3 doesn't have a guard. That's called a repeat offense. And now you can get an administrative penalty because we've done the same thing twice. So we definitely watch for the things that we've done the orders we've issued in the past, or the stop work orders we've issued in the past, and we're looking to see if those contraventions are continuing or not. So when you get the same one twice, that's also a special category you're in. So we do watch that. Great question. Any others on that topic? Nope. Okay. Okay, does anybody know what reprisal is? Without reading the text? Okay, so in Manitoba, we're one of the only, so every jurisdiction in Manitoba has some form of this. Most of them call it reprisal. Manitoba used to call it discriminatory action. And a discriminatory action or reprisal is when someone has exercised a right or a duty. It could be that, that's unsafe, or else, this is harassment that you're bringing against me, or I have a committee meeting and I'm on a safety committee and I need to attend that meeting, or I've called workplace safety and health because this is so dangerous, it's going to hurt somebody. Like, people have a right to bring safety concerns forward, to call workplace safety and health, to do a work refusal without having any punitive measure come against them. And that would be a loss of pay, a loss of benefit, a change in hours, location, duties. Like, if you work for a large company and you're working at, let's say it's 10, 15 years ago and the Human Rights Museum is being built, and you've been working at that museum for the last year and you're doing similar work each day, and all of a sudden you raise a safety concern, the next day you've been transferred to Brandon. That's called, that would be a nexus. We're looking at the time frame between when one thing happened and allegedly the punishment happened. When this happens, workers, and we're notified of it, we're often called. We will, as client service officer, so we get about 8,000 phone calls a year. We have 3 officers that answer the phone all day long. And we have people on call evenings and weekends. When that happens, we're going to have a discussion with them, and we're going to see if it meets the requirement of, if it is, my employer keeps catching me smoking in the bathroom, and I told him, stop bugging me about this, you're harassing me. It's like, well, no, that's not harassment. And they eventually fired me. It's like, well, that's not harassment. And you didn't get fired because they were raising safety concern of harassment. You're getting fired for smoking in the bathroom, right? Like, we want to vet out to see if it looks like it's going to meet the requirement of the legislation. So if it sounds like, yes, this does fit the legislation, it would then be assigned to a safety and health officer from our client service. The safety and health officer is going to get in touch with the employer and the worker, and they're going to start collecting. They're going to be doing interviews on it. They may go to the employer's office right away and grab the personnel file instantly before anything was added to it. Because people do things like that, right? And there's going to be an investigation. They're going to determine, was someone terminated for raising a safety concern or exercising a right or a duty protected under the Workplace Safety and Health Act. If they were, the officer has some big tools in their toolbox that they can use. They have the ability to reinstate the worker to the work if they were terminated. They have the ability to have any lost money paid back to them. So if it was a really unique position in Manitoba, and the person's been out of work for, say, 3 months by the time the investigation has concluded, or maybe it's even concluded in a month, but it's determined that this person would likely be out of work for 3 months, because we work with different websites to see how long it would be for a person like this to be employable. Like, for example, a nurse right now would probably be out of work for a very short period of time because there's a nursing shortage, right? Where other jobs, it might be very hard to find a job in that field. So they're going to look at how long a person like this might be unemployed, and they can order the employer to pay them back those wages. So they can have them reinstated, they can have the lost wages, they can have any reprimand removed from their file. So if there was something bad on my file because I raised this concern, they can order the employer to remove that so it doesn't exist anymore. And they can also issue an improvement order to the employer to make reprisals stop in the workplace. So it's large powers. Now, they don't have to use any of them, or they could use all of them. It's up to the officer in that place and time. Now, if it was a large workplace where we think that, or the officer thinks that the worker could be reinstated and be set up to succeed, like it's not going to be so toxic that it could go well. And the worker wants to go back to that workplace, you may see that. Often it's super toxic and the worker says, I don't even want to go back there, I'll find another job. That's often the case. Then it would just be the reprimand would be removed from file, make reprisal stop in his workplace, and lost wages get handled to the worker. I would say, guessing, I would say probably about maybe 70% of the time, it isn't reprisal. It's in favor of the employer. In those cases, there's been a good job of documentation done. In those cases, the employer has been able to prove to us that things weren't working out with his employer or with his employee. There's been many discussions trying to correct certain behaviors about their quality, about their level of respect they're giving the employer or other workers, about their attendance, other factors that that led into them terminating them. But what we are going to do is the officer, the onus is on the employer. It's written right in the act. The onus is on the employer. So it's called reverse onus. Prove to us that you didn't terminate this worker for raising a safety concern or exercising our right or duty. Right. So it's not even a deep investigation. It's prove it to us. And they're going to send us the information that supports what they're saying. We've had cases where you could see they're working with an agency a month ago to get this position posted to have the person replaced. Right. So they demonstrated their onus there that this person's time was already very limited. But it can't even be in part. Like it can't be 80% because of their attendance, their quality, and 20% because of safety. Even if it was 20% or 1% because of raising this concern, they would be protected. So it's even in part. So if it was, and this is where the officer looks at those 4 tools that they can issue. Okay. So if an officer determined that 99% of this was coming to the employee because of their performance and their quality and the level of respect they're given, but 1% of it was in part, the officer may issue an order for the employer to make reprisal stop in the workplace. Like you can't be retaliatory, right? Because that's the intent of the legislation is to make sure workers feel comfortable bringing forward issues that could hurt or kill people. We want to make sure that's welcome. Because if that's welcome, you're likely to reduce those hazards to workers and people won't die or get hurt or sick. So that stream should always be welcome information. So but in a case where maybe 99% of it was for reasons outside of the act and 1% of it was because of raising a safety concern, the officer may not issue them lost wages and the officer may not issue them to have their job reinstated. But they may have that portion removed from their file, or they may have an order to make reprisal stop in workplace. So it doesn't mean it's all 4, and it doesn't mean it's any of them. It's when reprisal is found, it's usually 1 or 2, but not always. There's been a few times where it's been none. Are there any questions on that one? I know it's a bigger topic that not a lot of people see because it doesn't happen as much. Like it doesn't have as much as stop work orders, but I would say we probably get 30 to 50 a year that we investigate. So there's quite a few of them. Nothing? Group? What else we got here for our next one? Okay, so like I said, we've issued 13,000 improvement orders or stop work orders a year. We make several decisions around reprisals, around work refusals. And because we do such a huge volume, there is no way that all of them are going to be right. We're going to make errors. And if you feel that you don't understand why you got the order, or you don't feel you should have got the order, or you disagree with the decision that was made, maybe you're an employer and there's a reprisal done and it sided with the worker and you completely disagree with that, and you maybe have information that wasn't initially considered or something, you can appeal that to the director. And an independent appeal will be reviewed separate from the officer that wrote the order or made the decision. Separate group of folks that report to myself will conduct that appeal. They'll gather all the information for the director and put it together in a package for her to consider. So when she's making her decision on the matter, she has the complete information plus any new information that wasn't initially considered the first time. Because often when we see an appeal being overturned, it's because there was new information that came in. I would say maybe 15% of the orders that are appealed or decisions that are appealed, 10-15%-ish, are overturned. So it does happen. I don't think it doesn't happen. And we have a rigorous process for that to make sure that everything is considered. An employer should have no concern of retaliation. That would be something that would not be acceptable. Our officers they know that if they have an order overturned, no one's in trouble. It's going to be a learning moment. If we find that this was maybe the regulation or the act wasn't contemplated, maybe appropriately by the officer, it might be something that's trained to all the officers to make sure everyone knows that, hey, when you see this section, this here would be acceptable, or this wouldn't be acceptable depending on the circumstance. Yeah. So any thoughts on appeals? Any questions, concerns?
A question that's come up before that I'm aware of is there what is the process for submitting an appeal? Is there a specific document or format that this appeal gets submitted?
That's a great question. The act, I don't have the exact section in front of me, but the act lays out how to issue an appeal. So you could, on the bottom of any order or any decision you receive, stop work order, improvement order, or decision by an officer for a work refusal or a reprisal, it's going to have the email address and the time frame to issue your appeal or to file your appeal. You have 14 days to file the appeal, and some of the things you would include are the reason for your appeal and any people directly affected by your appeal. So let's say me and 3 workers are working together and we're all doing similar work. And one of my coworkers says, this is dangerous work. I'm going to exercise my right to refuse dangerous work. And it goes through the supervisor and through the committee, and workplace safety ends up coming down and weighing in on it. And in discussions with the officer and the employer and the worker, that worker decides that if we modify the duties like this, I'm comfortable with that and I'll return to work. And the officer says, okay, I'm good with this. I'm not going to support the refusal with this latest change, and you guys can continue with the way you're working. I might not feel comfortable with the measures that were put in place. So I'm a person that's directly affected by that decision. And I might say, you know what, I'm appealing your decision because I think I'm still at risk and I don't like it. So even though they'd have to show how they're directly affected by it, it has to be someone directly affected by it that can appeal the order or the decision. So that doesn't happen very often where like a third party type person weighs in on it, but it does happen. So if you were to initiate the order or an appeal to the executive director or the director in the act, you would get a response saying, thank you, we received your appeal and someone's going to be in touch with you. Within a few days, one of the officers or one of the staff or officers that report to me will be in touch with you. I have a few different mechanisms I use. I have officers that report to me, but I also have an engineer that reports to me, and I also have a person who's legally trained that reports to me. She's not our lawyer, but she is a lawyer. Like, so she doesn't, if something comes in that's like officially from justice or something, that would go over to justice. Or she's legally trained, but she's not our lawyer, but she is a lawyer. So if someone is challenging maybe a CSA standard, I might assign that to our engineer. If someone is challenging the interpretation of the act or the reg, I might assign that one to our, the person that legally trained. Or someone is just challenging the reg saying that, you know, I got this order and, the stop work order, and I wasn't at 10 feet, you know, we're at 9.5 feet. I want to appeal it. That would probably go to safety and health officer. So I kind of look at, when the appeal comes in, it comes to myself. And I look at what is the appeal here? What is their argument? And then I try and align it with the person I think would be best suited to gather the information for the executive director on that appeal. And now that person will be in touch with the appellant within X amount of time. And they're going to say, you have a week to, you have 7 days to provide me with all this information. And it's going to be the reason why, it's going to be any people directly affected, any new information that the original officer didn't consider in the decision or the order, which is often the big thing that changes, because it's new information, right? No one has looked at it before. And then there will be maybe some phone calls going back and forth and some emails, like, depending on the scenario. And we're going to gather that information and put it into a package for the executive director. And then ultimately a decision will be made. That answer your question?
Yes, thank you.
Okay, how are we doing for time, Mayor? 12:51, so I think that concludes it. That's was our last slide. Does anybody have any questions? We have 8 minutes still. Any questions at all? Open workplace safety. Nope. Okay, well, quiet crowd. Megan, I will flip this presentation to you because I made some smaller tweaks just as we were in the queue here. And you can send that out if you'd like.
Perfect. No, thank you. And I'll just take a few minutes. We're not in any rush to sign off yet. So as people are maybe contemplating something to ask Marty, I'll just highlight a few things here on our end. So Marty, I'll just get you to unshare your screen if you can.
Okay, for sure. Get over there, sorry.
Yeah, no worries.
There you go.
And yeah, so if you just take a few minutes to think about what you're wanting to ask Marty, I'll just highlight a couple things here on our end. I think you can see my screen here. Obviously, today was Marty's presentation, and tomorrow we have another Lunch and Learn coming your way with Jennifer Willems and Lindsay Gilson from WCB on how to build a successful return to work program. So you may have already registered to attend. If you haven't already, you're welcome to through that same means as you registered for today's, and a link will be sent out to you shortly. So that's for tomorrow at the same time. We also have some Northern training coming up at the end of May. So if you have work sites in Thompson or the PAW or in those near those communities, we do have training coming up. You can check our website. We also have our CSAM app. You most likely have already downloaded this, but if you haven't, please go check that out. It's a lot of great information there. We also have a lot of information on our website on Toolbox Talk. So I know Marty was talking about excavations. We do have a Toolbox Talk on our website, actually on our YouTube channel, specifically relating to excavation. So take a look at that if you're looking for some information for your work sites. And then in general, we have the safety scene on our website. This gives us and you an ability to see kind of what's happening in safety in Manitoba. So check out that on our website, constructionsafety.ca, the safety scene, for more information on events in Manitoba. We are very active on social media as well. So likely that is one way that you found out about this webinar was through our social media. And feel free to continue to join us there on social media as well. And last but not least, I would encourage all of you to give us an evaluation on today's webinar through this QR code on your screen. You can scan that with your camera, which will take you to an evaluation. You can select Safety and Health Week webinar, and then Marty Danielson's name will come up there. And we'd love to get your feedback on this session. And if there's other sessions you're interested in, that would be great to hear from you as well. So I thank you all for attending this session. This is your opportunity to ask anything that you might have. And it does look like we do have a couple things here that's popped up here from Kathy. Thank you. We always have at least 4 toolbox talks about workplace safety and health, stop work orders, admin, etc. from the site. Good discussion for us and helps everyone to be aware. So thank you. Tracy says, thank you for the presentation. Rob says, thank you. And then last here, Tracy says, I do have a question about testing for asbestos. So Tracy, you're welcome to unmute yourself if you'd prefer, and ask that question for Marty. Okay, so she's asking in the chat here, when should a property be tested for asbestos?
Great question. So this might surprise you folks, but any building built prior to 1990, I think 1987 is the actual term, but we tell people 1990. Any building built prior to 1990 is likely to contain asbestos or may contain asbestos. When you start getting into the 80s and 70s though, we will, if it's not tested, we'll consider it tested. If it's not tested to prove it's asbestos or not, we will automatically consider it to be, it's called ACM, asbestos containing material. So if we see like the 9x9 floor tiles, and if we ask for an asbestos inventory and you say you don't have one, it's going to be considered asbestos. So you're going to have to treat it like it is, unless you get an inventory done to determine what is asbestos and what isn't. You'd be shocked at the amount of material there, or maybe you all know it, but it's in exterior, like the shingles on the hard shingles on the side of buildings. It's in stipple, it's in drywall mud, it's in glue, it's in concrete, it's in insulation, it's in plumbing wrap. It is everywhere. So an employer in Manitoba that has a building that's built prior to 1990 needs to have an asbestos inventory. So if a worker, so like for example, I have asbestos in my office. Just because you have asbestos doesn't mean it's dangerous. If it's broken up, that's called friable. That's when it becomes really dangerous. But if it's intact, it's not dangerous. It's not disturbed. It's not dangerous, right? But as soon as it's going to be disturbed, you have to notify the branch prior to disturbing it, and you have to have I'm not going to even try and guide you on the measures we take because I'm not an industrial hygienist, but we do have them on staff. But if you were to have let's say we had a plumber or an electrician come to work on the building, we have to show our asbestos inventory so they know where the asbestos is, and we can't let them disturb it. It can't be, here's our inventory, you know now, and you gotta be careful. No, if they're gonna be disturbing the asbestos, it have to be done appropriately and remediated and whatnot prior to them working in it, because they can't be at a risk to it. So there is lots of guidelines. If you go to the Safe Work Manitoba website, there's guidelines on asbestos and demolition that'll walk you through where it's likely to be found, and some tips on what to do. If you don't know what to do with it, you can call client services here, and an officer will help walk you through it. I can tell you that you've probably seen in the media recently, there's huge expenses associated with demolition and asbestos. If an old building burns and it's knocked down, that whole pile can be considered a hazardous material, and it all has to be treated like it's asbestos. So even the brick that might not initially had asbestos in it is now coated with asbestos. So it's all hazardous material, and it can be hundreds of thousands of dollars just to haul that away appropriately. So a lot of times employers are better off to identify the asbestos and remove it prior to something like that happening. Now it's expensive to deal with. It's super expensive to deal with. Either way, it's not going to be cheap. So I think there might be people out there that's an incentive for them to do it in a dangerous method, and that's what people are exposed to it, and they end up getting sick. But the magic number is anything built prior to 1990. You should check it. Now, if my house is built in 1988, I had a house I was in Crescentwood prior to even working here. I didn't really know much about asbestos. I was gonna do my bathroom. My wife's like, she knew about this stuff. She's like, Aaron Brockovich type person, right? She's always looking for what's making us sick and whatnot, a pioneer in that area. And she looked in her attic, and but she had me looking at it. And we had vermiculite in her attic. And it's fine if you don't disturb it, right? But everything else wasn't asbestos containing material, so we were fine to go ahead and do a renovation. I just couldn't remove the ceiling like I was initially going to, right? Because that would have been raining asbestos on. So I didn't, but again, it's 20 years ago, I didn't know. And I think there are lots of people out there that were just like me that don't know about asbestos. The difference is I was a homeowner at the time, and I wasn't putting anyone at risk, but my own ignorance putting me and my wife at risk, which is horrible. But if you're in a workplace environment, it's not in defense. I'm not trying to be ignorant, but you can't say to an officer or a judge, "Oh, I didn't know." Like, you're still going down that same path, right? So putting people at risk. So, great question. And for 1990, there's lots of guidelines available that kind of point you towards the things that could be asbestos in material like your structures.
Excellent. We also have Norman asked, does an asbestos inventory report saying negative for asbestos guarantee 100% that asbestos presence is indeed negative?
So what we do is you wouldn't do, again, I'm not an industrial hygienist. We have industrial hygienists with staff that do this for a living. So often you'll get multiple samples taken from an area and send it off to the lab. So it would be multiple samples coming back saying this pipe wrap, like there might be, let's say, for example, there is hypothetically 10 samples of this pipe wrap taken from a building, and all 10 come back as not containing asbestos. I would feel comfortable that there's no asbestos in there. But we have had them where lots don't come back containing asbestos, but some do. So we know asbestos is in there because it was positive for it in some of the samples. So it would all be treated like those asbestos.
Excellent. Well, thank you very much, Marty.
Yeah.
I know that you've already shared your contact information, so those people who are interested to reaching out directly to you, I'm sure can do that as well. Thank you again, and thank you all for attending this afternoon. We will be posting this to our YouTube channel the next couple weeks. And if you are interested as well, we will also send out the PowerPoint information as well that Marty has shared. Thanks again, everyone. Enjoy the rest of your day.
Have a nice day. Take care.
Bye, Marty.